The treatment process for uterine fibroid under us is very similar to the ovarian cyst treatment. A case taking is done to understand the medical circumstances of the patient. A proper documentation is done about the menstrual irregularities that are being experienced and therefore are being attributable to the uterine fibroid. We would repeat ultrasounds periodically, ultrasonograms periodically. It could be every 3 months, it could be every 6 months, depending on this, again, the circumstances of the patient. We will also get subjective feedback from the patient on a monthly basis to understand how her menstrual condition is changing. We plan the treatment, we get the feedback, the subjective feedback. We also get the ultrasonograms. We compare the old ultrasonograms with the new ones with the objective of finding the size difference between the fibroids. What was the size before? What is the size, say, after 4 months? Again, after another 4 months, we would want to compare them. We would want to see that the size becomes gradually smaller. But please bear in mind that when a treatment is being started and the fibroid is, let's say, 5 centimeters by 4 centimeters, it was one day 0 by 0 centimeters. So that means it has got a speed of growth. So it was growing at a certain millimeters or certain centimeters per month over a period of time. When the treatment is started, the growth rate has to slow down and ultimately stop before it can regress in size. That is also very important, and we would want to see that happen in subsequent ultrasonograms. Usually, endometriosis is the broader disease process which leads to the formation of uterine fibroid, and hence we can take a cue from a blood test called CA-125, which gives an indication of what the disease process is. Of course, that is a blood parameter. Changes happen faster there than the physical fibroids. So we can get an early indication whether our treatment is working in the right direction or not by repeating the CA-125 blood tests. We have a very cohesive treatment process which our entire team of doctors share and implement, whether a patient is visiting our clinic or is using our telemedicine service or a combination of both. My team works as almost one person to be in a position to deliver the treatment. Using our medicines, which are not harmful substances, they do not have any kind of side effects, they are not crude substances like, let's say, hormone replacement therapies, which have known profound side effects on the system. So our proposal is to implement a treatment which is non-invasive, safe, and does not have any kind of side effects using our kind of treatment, and keep hysterectomy as a salvage option as opposed to be as the primary option. There is a very big difference between the two.